The Omicron variant has led to some of the highest daily total of new cases across the entire pandemic. Now, statistics from the state show 6 days in January with over 2,000 new cases, including January 19th, which holds the current record for cases in a single day at 2,474. That's more than 1,000 cases greater than the highest single-day totals of the first COVID-19 surge in the fall of 2020 and the Delta variant surge of 2021. Now, it's important to understand how the state tracks daily cases. You may have seen this before. Now, when the state releases its COVID totals, or its total new cases each day, that number represents positive results from tests done over multiple days. Now, those results are then allotted to the day tests were done on this graph right here. In Helena, Shodair Children's Hospital and St. Peter's Health say the increase in cases related to Omicron and the continued pandemic have created a severe staffing shortage. I spoke with both hospitals about the impacts of the staffing shortage and how they're addressing it. Amid rising COVID-19 cases in Lewis and Clark County, both St. Peter's Health and Shodair Children's Hospital are saying they're severely understaffed, potentially leading to longer wait times and limited availability of inpatient beds at St. Peter's and a wait list for children in immediate need of psychiatric care at Shodair.
I think they're really frustrated. I think they're burnt out. They're stressed. They're waiting for those life preserves and becoming impatient.
They're tired. That it's not fun anymore, that they feel devalued by the community.
According to St. Peter's website, they employ over 1,700 community members and currently have 338 open jobs. Nearly 20% of the hospital staff is open. And while not everyone on staff is working directly with patients, everyone is playing a vital role in the healthcare sector. At Shodair, a children's hospital that serves children all across Montana, there are 20 open positions of nearly 330 employees, or approximately 6% of the hospital staff. But that doesn't include employees that are having to quarantine or isolate due to a positive COVID test.
And I think there's probably been times, I'm totally guessing here, probably if you were to take 200, that would be available.
St. Peter's says prior to the pandemic, turnover at the hospital was around 4%, and now it's sitting around 15%. In response, the hospital raised its minimum wage, recently announced a $3 million investment in base wage increases, and plans to continue that trend this year in an effort to recruit and retain employees. Shodair has also increased their minimum wage and salaried employees' wages amidst the pandemic, while also creating time banks for them to use if they do test positive for COVID-19.
We recently doubled the size of our recruitment team here. We went from 3 to 6.
We created banks, COVID banks for people to use.
As for the future, both hospitals hope we'll be seeing a light at the end of the tunnel sooner rather than later, but both know we're far from it and are asking for people's help to alleviate the burden on healthcare workers.
And that is be kind. Remember that the whole world is short-staffed, and so please be kind to those who continue to show up for us and for you.
In Helena, Sam Hoyle, MTN News.